Hello. Good evening, fellow friends and loved ones. Um, Sorry for the poor lightning system. Actually, we have some power fluctuations in around, yeah. But I'm sure that we'll learn a lot today. Yes, despite everything, we'll learn a lot today. Thank you very much for your time, and I trust that we'll have a wonderful time this evening. So today, in fact, we plan on having a very wonderful discussion despite anything that has happened. Okay, so we thank God for a wonderful evening. Yes, so today is the last day of the month of the first year, 2021, and I'm thankful for the opportunity given me for us to discuss this topic. Yes, sorry for the lighting system. I'm sure that we'll have a wonderful time despite the lighting system. Yes. So today we are talking about a topic called um multiple sclerosis. Yes, multiple sclerosis. It's been a wonderful day, and before we begin, we want to give out our outline for the presentation. Then we'll continue. So today, um we're going to have the topic that is, we've mentioned it earlier on, multiple sclerosis, then a quote for the day, and then the definition, the history, and then we're going to talk about the causes and the risk factors, pathology, the condition itself, the diagnosis, and the signs and symptoms, and then treatments for this condition called muscular or multiple sclerosis. Yes, and then various social interventions for treating this condition. And then finally, lifestyle modifications. Then our next topic for presentation, that is next week. Okay, so sorry, please pardon me for a minute. It's likely um okay. So thanks be to God. The lights have come on again, and I want to thank God for that. Yeah. So we're talking about the condition multiple sclerosis. Yes, it's a very interesting condition actually. Um, I'm sure that we'll have a wonderful time in a discussion. Okay. So first of all, what is multiple sclerosis? Yes, it's a condition that affects the central nervous system. When we say central nervous system, it involves our brain and our spinal cord. So the brain is inside our head, and the spinal cord runs from our neck down to our lower back. So when you say spinal cord, that is what it means, from the brain to the spinal cord. So the fact is that this condition affects our brain. So there are some structures in the brain that we call um, neurons. Yes, neurons. Neurons are various structures. They are long, thin structures that help to transmit information. So when we talk, as I'm talking right now, these structures called neurons send information into the brain and back into my mouth or into my eyes, and they communicate. So as I'm even moving my hands, there are information that goes from my brain to my hand to even do this. This information goes through a process we call the myelin or the neuron transmission process. Yes, so by this by this, there is transfer of information from the brain through our system. So there's a very important structure in the brain that we call a myelin sheath. So as I'm mentioning very scientific terms, but I'm sure when we look at pictures, we'll be able to appreciate this the better. Okay, so I mentioned myelin sheath. So the myelin sheath is actually a structure that covers this neurons I mentioned earlier on, that helps to transmit information right from the brain into our various structures, our hands, our legs, our feet. Yes, very, very efficiently. But when this structure is not there, called the myelin sheath, the information is not able to transfer from through the neurons into our hands and our legs and our feet and our shoulders. Yes, so this structure is very important. The myelin sheath helps transmit information through the neurons back into our bodies, that is our hands, our feet, our legs, our shoulders. So just before I continue, I'm sure that this myelin sheet will be quite a very strange thing for you, so let's look at it before we continue so that we'll have a very, very fair idea. Okay, so just a minute. Okay, so this is what I'm talking about. Yes, so that I'm sure we understand this. Yes, so you can see this. Yes, this is the neurons. The neuron is in the brain. This structure is called the neuron, and it's in the brain. So we have neuron connecting to this, and connecting to this. So this connects to this, and then in chains, and this helps transfer information from one part of the body onto the other. Okay, so this is what we call the myelin sheath. This one, this cover is called. Let me give you a better one. Okay, so this is very important. So you see this yellow thing, it's called the myelin sheath. Yes, and this blue thing is called the neuron. This blue thing is called the neuron, and this myelin sheath helps the neuron to transfer information into our body, into our legs and our hands. So you see, this is the brain. So in the brain we have the myelin sheath. You see, this has been elaborated and has expanded into this. So this big thing that we see here, if you look into the brain, yes, we have it as small as this, and they are connected one after the other, and they transfer, or they help to transmit information from the brain to the spinal cord, then to our neck and our shoulders and every part of the body. And this helps us to feel and helps us to move. Okay, so I'm sure we have a fair idea now of what a myelin sheath is and what a neuron is. So we continue. So before we move on to the condition itself, let's look at some history. So in the 2008, yes, WHO said this condition is one of the most common conditions outside, that is not in Africa though, outside, because of so many factors. And so we'll continue these factors very soon. And so they said someone called Benedetto Saraceno, yes, is a scientist, and he said that yes, this condition is one of the common neurological disorders that causes disability in adults. But despite that, it can also affect children and also can affect young adults. But mostly he classified this as affecting young adults because of the fact that they are engaged in more activity and tend to lose the myelin sheath, that is the covering around the neurons, very early. We showed it very soon, in some few seconds ago. Okay, so, and then also one key statistic was that he mainly related this condition to people living in high income country areas, that is Europe, America, Asia, thereabouts, but he didn't really refer to Africa. He said that also because this condition called the multiple sclerosis has a connection with vitamin D, and vitamin D is mainly got from the sunlight. And one factor is that Africa has enough sunlight. Every single day we have sunlight. In fact, throughout the year there are very few occasions or few months that we have rainy season and then very cold season, as compared to outside that we have more of the snow, the winter. Yeah, so he mainly related this condition to lack of vitamin D, that is vitamin D deficiency. And also he said that this condition is mainly because of the fact that there is viral infection around this structure we call the neuron, or specifically the myelin sheath. So now the condition, multiple sclerosis, is a disease of the nervous system, that's the brain and spinal cord. We saw the structure this previous slide in the previous seconds ago. We'll look at the pictures more in some few minutes to come. He said it's a disease condition that affects the nervous system and is the most common neurological disorder of people within the ages of 20 and 40. So if you are within the age of 20 and 40, you are likely to have this condition, but preferably outside in Europe or in America. Even Asia is very less often because they also experience some sunlight as compared to Europe, where they have more of the winter. And then if you go to the Arctic and the Antarctic, where they are very cold weather conditions, statistics say that they are more of having this condition. They are more likely to have this condition called multiple sclerosis. It's a disease that affects the brain or the spinal cord. Also, some histories also say that in 1421, I'm sure we were not born by then, August 4th, there's a man called Jan van Beveren. Yes, he also made a very emphatic statement that there was a woman who was 15 years who developed this condition, and then she lived only for about 30 something years. So it's stated that people who have this condition tend to live a lesser of 10 years or a lesser of 5 years as compared to a normal person. So if someone was born to live to about 50 years, then if he or she is susceptible to this condition called multiple sclerosis, then he could live to about 40 years or 45 years because the fact that the margin sheet is necessary or will deplete, that will be shortened, and this will cause him to live a lesser years as compared to a normal person. So some of the condition that he saw in this person was that the person has weakness in the legs, so the person could not walk in a shorter period of time, probably in 2-3 years, the person is not able to walk. And then also the person has numbness. Yes, the person has numbness in actually both legs, and sometimes it gets into the hands. And also the person has intermittent pains within the joint, and then the person was blind in one eye. So per this classification, that is not being able to walk, being able to feel or numbness, and then not be able to see, the person was classified as having multiple sclerosis. Okay, so another history was by someone called Jean Martin Charcot. He's also a scientist that lived within the ranges of 1825 to 1893, and then he was a French neurologist, that is someone who studies the brain and associating conditions. He was the first person to recognize this condition as multiple sclerosis, and then he said it was distinct condition that affects people living in humid conditions, that is where they have cold weather conditions and absence of sunlight. So when there's no sunlight there, it predisposes them to having this condition called multiple sclerosis or nerve damage disease. Okay, so he summarized this condition as a very, very, very harmful condition, and then it could deteriorate, it could progress, and it could have general body weakness where you're unable to walk again. But then early signs of this condition, when it's reported early, the person could return to normal function and maximize function as early as possible. So we're seeing various signs and symptoms so that we can be able to report as early as possible. There were so many scientists such as Robert Caswell, he was a professor in pathology who helped to classify this condition. There were so many people. And so, as we mentioned, this condition is mostly seen in countries in the northern part, that is America, northern Europe, Asia, which is lesser though, but it's seen there, Europe and America. But in Africa, there are very lesser statistics here because of the fact that there is enough sunlight here. Okay, so in science, that is when it comes to medicine, we mention this condition as encephalomyelitis, disseminator. So this is a condition that actually is mentioned among doctors. Doctors classify this condition as this encephalomyelitis disseminator. Okay, so as we mentioned earlier on, it affects a structure in the body called the brain or the spinal cord, which come together to form the central nervous system. And then this central nervous system, that's the brain, has a structure we call the myelin sheath. This protects a structure also we call the neuron that helps to transmit signals, so information from the brain to the eye, to the nose, to the mouth, to the ears. And then if this myelin sheath is not protected or is reduced in terms of its size, therefore information transfer to various parts of the body is impaired, it's not well sent, and this could lead to this condition we call multiple sclerosis. Then we are unable to either move well, or we're unable to feel well, or presumably we're unable to see well. Sometimes it affects our eye, so some people are not able to see well, they have poor eyesight, or even they go blind in one eye as a result of this condition. Also, there are so many types of this condition. We have 4 main types, which we'll be discussing very soon. And as you mentioned on, it affects people within the ages of 20 and 40, or it could be 20 and 50, as per statistics present this condition. This condition is actually a long-term condition, but then when it's recognized or it's realized early, there's effective and then very, very less form of disability in terms of its effects. Okay, so what are the causes of this condition called multiple sclerosis? There are so many conditions, yes, so many causes of this condition. First of all, one, it's unknown. Yeah, there are some types of this condition that is unknown. Actually, we don't really know the cause. It just comes because the body has this way of fighting any foreign object or substance that comes into it. That is, we call autoimmune. So in the fact that it's autoimmune, in terms of its cause, it just comes and attacks. There are various infections that comes to attack the brain, and then causes the myelin sheath to reduce in size, and this will result in what we call multiple sclerosis. Then also we could also be as a result of genetics, that is our family. So if your parents have it, you are likely to have this condition called multiple sclerosis. If the parents died from this condition, you are likely to have this condition. You have a higher chance of having this condition. But that doesn't mean that there is no way of managing this condition. There's very good ways of managing this condition. Okay, so some other causes are due to environmental factors such as infections. So if you have bacterial infections or you have viral infections, there are so many viruses that could lead to multiple sclerosis. I'm not saying COVID is part, but well, let's leave it to the scientists to talk about that. Okay, so actually the prognosis, that is the rate of having this condition cured or managed to the best of ability, is that is between 5 and 10 years. So people are able to live better when managed by rehabilitation and then medication. So these are very important to help to manage this condition in a better way. And as you mentioned, when you have this condition, your life expectancy, that's the ability of you living for long, is reduced by a year of about 5 or 10 years. So if you had to live to 20 years more to live, you could live probably 15 or 10 years more. Okay, actually, as I know, there is actually no street known cure for this condition, but there are various management practices that helps the person to live a very appreciable and better life. Okay, so actually the main cause that is by scientists stated is the fact that it's an immune related or immune mediated disorder. When I say immune mediated, it means the body recognizes a foreign body in the brain and then it fights it. So in the process of fighting this foreign body, it attacks the myelin sheath, that is the structure in the brain called the myelin sheath, and then it causes it to reduce in terms of its size and its ability to carry out information. Then there is poor information transfer, and every part of our body requires information to be transferred before we can move. So my brain has to say, close your mouth, before I can close my mouth. If there's no information from my brain to say close your mouth, I can't close my mouth. So these myelin sheaths are very important to help to transfer the information. So when they are not transferred, then we have this condition called multiple sclerosis. As at 2015, researchers stated that about 12,000 cases, that is 12,000 deaths, were recorded from 1990. Yes. And then also in the year 2015, we had 18,900 deaths. We had also 12,000 deaths in the year 1990. And so, what are some of the symptoms of this condition called multiple sclerosis? We could have fatigue, we could have memory problems, it could be that you couldn't see well, and then you could also have anxiety. You could be anxious. If you see someone so anxious, it could be signs of multiple sclerosis. That doesn't mean that it's multiple sclerosis. Okay, and the person could have visual problems. The person could have a condition called optical neuritis, that's inflammation of the eye, and also the person could have diplopia, that is, the person could have double vision or blurred vision. Also, the person could have speech problems in terms of talking. The person is not able to articulate or speak very well. The person could have weakness, especially in the lower limbs. So as the condition progresses, the person is not able to walk well. The person uses an aid, a walking stick, or sometimes a walking frame. The person also has trouble in walking. The person has instability in terms of walking. The person has incontinence. The person could have also constipation or diarrhea when the person has this condition called multiple sclerosis, because information from the brain is not able to send signals into the various organs of the body to maintain its composure. The person could also have urinary incontinence. Okay, so aside these symptoms, there are various outcome measures that helps us also to see the progress of this condition. One outcome measure is the expanded disability status scale, and a physical therapist or medical doctors, they use this scale to be able to measure the rate of progress or the rate of deterioration of this condition. Okay, so aside that, actually this condition is one that can be managed and treated to the best of ability, but then when it's not managed well, there could be a resurgence, that is a recurrence of this condition. This could be as a result of viral infection, as we mentioned earlier on, such as common cold, influenza, gastroenteritis, and this actually increases the risk of recurrence of this condition. Also, stress can also trigger this condition to occur. So we advise that we try to manage our stress. We don't do too much work. We have enough rest, and then we take time off to do other things aside our heavy duty activities. As I mentioned, this condition affects people in the northern hemisphere, that is America, the northern Europe. Okay, yes, so there are so many types of this condition, and we have mainly 4 types of this condition. Yes, 4 types of this condition. We have the clinical isolated syndrome, we have the relapsing remitting syndrome, we have the primary progressive syndrome, we have the secondary progressive multiple sclerosis. Okay, so there are 4 types of the condition, and actually it's very important to understand how this condition comes about. Yes, and we could have one, the infection process. We could have also another type, that is where we have the familial condition, so where it's transmitted through the genes from our mother or our father, or both of them coming together to cause this condition. Actually, the genetics type of this cause is actually still in study, and it's shown that 20% or 60% of the instances of both parents could bring this condition to bear in the child. And for infections, actually, as we mentioned, when your brain is infected, that is any viral infection such as cold or influenza, it causes the body to release various soldiers, that is foreign bodies, foreign antigens, to be antibodies to be able to fight this foreign body, that is the cold or the influenza. And in the fighting, they destroy this myelin sheet, and this could predispose us to having this condition called multiple sclerosis. Okay, there could be so many instances. Actually, you could have lesions, that is infections. You could have one also important thing is smoking. So if you smoke a lot, you could predispose yourself to having this condition called multiple sclerosis. So let's advise our various fellow friends, our various loved ones who smoke to avoid smoking, because if you smoke, you have a tendency of having this condition called multiple sclerosis. Okay, so aside that, how can we diagnose this condition as medical doctors or physiotherapists? Yes, we need to we mainly we use the MRI or the CT scan, but preferably the MRI, called the magnetic resonance imaging. So this gives us a clear view of the inner structures in the brain. Then we can see whether there is any depletion in terms of the amount of myelin sheet in the brain. So when we see very reduced amount of myelin sheet in the brain, then we can say the person is likely to have multiple sclerosis. Okay, so the prevalence of this condition, that is, there's a study that has shown that men and women have an equal chance of having this condition. But then when we look at the younger adults, women are more predisposed to having this condition as compared to men, that is young adults. And then it's shown that out of 3 personalities who have this condition, 2 could be women and 1 could be a man. And it's shown that actually there is a less of men affected because of the fact that probably they have their hormones are preferably on a, that is, I'm just giving a very general instance, they have a probably low hormone producing ability as compared to women who actually have their hormone levels at a peak at the age of 20s. Yes, so that is actually one explanation to that. And then another very important fact is that this condition can be managed and managed very, very well. It can be managed very well because through rehabilitation, that is through exercises and through medication. One very important medication is the biotin. The biotin is very, very good medication that helps to prevent this depletion of the myelin that's in the brain from becoming worse. So it reduces the rate of progression of this condition becoming worse. So doctors will prescribe a drug we call biotin, and this helps to improve the condition. Then we go through exercises, that is neurorehabilitation, and this is very important to improve strength and improve circulation. So we engage in various physical exercises, such as aerobic exercises, such as you can go active exercises, you can go to probably cycling. So we engage in cycling, that is moderate cycling, and then also we could engage in walking. So if someone has this condition, we encourage the person to do more walking, or if the person is so strong, the person can do a moderate jogging, and this helps to improve the condition. And then also stretching, to engage in stretching exercises to be able to increase the strength of the muscles and also improve nerve regeneration. We call the process of gaining the strength in the brain called remyelination. So the fact that the nerves in the brain grow again, and then the myelin sheet in the brain also begin to grow back and then cover the neurons and then help to transmit information, is very, very crucial. So exercise is very important for this condition. And then also taking of medications, that is a biotin. the biotin. Okay, so we could also do TheraBand exercises, which will be showing very soon, exercises for this condition. Okay, so let's look at some various exercises for this condition, and I'm sure that we've talked a lot, and so let's look at some exercises and let's look at some pictures for this condition. Okay, okay. So this is the condition we're talking about. Yes. Okay, so let's look at the pictures so far. Just a minute. So this is the condition. Actually, it affects so many systems. It affects the eye, it affects the spinal cord, it affects your tongue, it affects your brain, it affects your kidneys, it affects your digestive system. You can see it can affect your senses, your ability to feel, it affects your muscles. Yes. Sometimes people, those having this condition, when you give them a glass of water, they can't hold the cup well and they begin to shake, and then it slips off their hands. So this is actually one of the signs of this condition. You can see the glass falling off from the person. Okay. So some of the complications of this condition is that the person could have pressure sores, the person could have sores, the person could have the hands being contracted. The person could also have osteoporosis. If we talk about the condition the last time, that is broken bones. The bones can become very weak, that the person cannot walk well. Okay. So this is the brain. So this condition affects the brain, actually affects the brain. So this is the condition. We're talking about multiple sclerosis. So it affects the eye, the ear, the mouth, the even the digestive system. This is where the food goes. Okay. So you can see it affects so many systems in the body. Okay, so this is the new one. You can see this is the normal one. You can see the very good color. You can see the blue coloration here. It's very clear, very clear. But look at this one. You can see this. There's some 10 or torn off patches. You can see the torn off patches, and this could indicate on the MRI what we call multiple sclerosis. Okay, so these are the systems that it affects. Yes, you can see them here very clearly. Our speech, our eye, our balance, the spinal cord, our muscles, our immune system, our bowel and bladder function, that is ability to go to the urinal or go to the washroom. So the spinal cord, this is the spinal cord I was talking about. So you see the brain here. From the brain you go to the spinal cord and goes down into the body and connects to your neck and other parts of the body. Okay, so these are some of the signs of this condition. So you can see more signs. Yes. Okay. So this is the normal spinal cord, and then the myelin sheet. This is the myelin sheet. It covers the neuron. The blue one, the neurons, and you can see the multiple sclerosis here. You can see the myelin sheet. The green one has been torn off. Look at this part. It's torn off, and this one is torn off. So information is not able to it's not able to be transmitted or get transmitted from the brain right into the system. So you have poor information transfer from the brain to the parts of the body, and this could cause impairment or lack of movement of various parts of the body or malfunction of certain body parts. So you can see this man here is very tired. You can see this is some of the symptoms of this condition. Okay, so we can see the multiple sclerosis. You can see, yeah. So we could also have another test to be able to diagnose this condition. If it's by infection, we have a process we call the lumbar puncture. So you see this needle here, we puncture it through the skin directly into the body, and there's a fluid here called the cerebrospinal fluid, and this, when we tap it here into this system here, we can send it to the lab, and if we see infection there, then we can also see it's multiple sclerosis. Okay, so we can see some of the risk factors for this condition. Okay. So this is the MRI. So I've mentioned MRI. So this is called an MRI. So when a doctor asks you to take an MRI, so this is how it looks like. This is a normal MRI, and this is the depletion of this MRI. You can see this. You can see the shape here is different from the shape here, and these are signs of the condition we call multiple sclerosis. Multiple sclerosis. We could show so many pictures. But okay, so this is an MRI. You can see the dots here. So this, for this one, the doctor sometimes puts some chemicals into the brain, and this could show that there's depletion in the myelin sheath. So this is also a technique that the radiographer or the doctor does to be able to diagnose this condition very effectively. Okay, so you can see the very visible. You can see the myelin sheath. This is the myelin sheath, the orange one, and this is the neuron. So this is the normal one here, and this is the incorrect one here. Okay, so yes. So these are some of them. You can see more here. Okay, so okay. So these are some pictures. So this is someone who has got the multiple sclerosis. They're giving a machine to be able to work with. He can't walk well, so the not in Ghana though, but outside there are various machines that help them to be able to walk well. You can see that he's using an elbow crutch here. Okay. So this is a physiotherapist trying to do some exercises for the patient. Okay. So I'm sure we've seen so many. Yes, but I promise to show us some exercises. So let's see some exercises for this condition before we close. Yeah, I'm sure we can see some group exercises for this condition. Okay, so yes, we are ready for the exercises. Okay, so just some few seconds for the exercises. Okay, so these are some exercises that we can go through. So if you are young, we go through this exercise, but when you are old, we go to, this is for young people who have this condition. So this condition is most prevalent in people of the age 20 and 40, so they can go through these exercises. Okay, so I mentioned a TheraBand. So this is a TheraBand. You can see this is a band. So yes, it's called a TheraBand. What the one is using is called a TheraBand. Okay, so some of the exercises that we engage in when you have this condition called multiple sclerosis. So if you are old, we just engage in various simple exercises. So you can see this woman here sitting down. So this helps to strengthen the arms and then the lower back, even the whole back. Okay. These are some exercises. These are some group exercises that we engage in. Okay, this is called the TheraBand. I'm sure we can understand it now. So some wrist exercises. This is a weight. That is a dumbbell. Okay. So there are so many exercises. These are the group exercises that we engage in as young as. Okay. Some simple exercises that we engage in. Okay, so I fulfilled my mission. Yes. Okay. Yes. Well, thank you very much for the wonderful time. It's been an awesome time. Yes. Thank you very much for your time here. I'm sure we learned a lot from the condition today, multiple sclerosis, or it's a nerve damage disease. I'm sure we can teach other people, and then if we see some people experiencing this condition, that is having weakness in the legs and then the arms, they can't feel well, they can't see well, and they're not able to remember things well. the best thing is to report to the medical doctor or the physiotherapist to be able to assess this condition and then treat them accordingly. Okay, so thank you very much for your time. So without further much ado, if you have any question, yes, please you can ask. I'm sure there's so many people watching online also. You've kept long today, but it was worth educating. We can see Zafa, we can see Emmanuel, Evans, Jermaine, yeah, and so many others. Okay. Did you have any question? Okay. Any question? Okay. So without further question, we're talking about the condition that affects children actually in our next presentation. We call developmental dysplasia of the hip. That is where we have dislocation of the hip in children. So when you give birth to your child and the child has dislocation in the hip, what is it about? What causes it? And we'll be talking about it in our next presentation. So let's stay tuned, let's share the flyers, and then let's come on board. Thank you very much for your time. May the Lord be with us all. And a blessed month of February. Take care. Have a blessed evening. Goodbye.